So I'm just going to talk through some of my, basically my overall learning strategy and learning techniques that I use currently as an M3. So I call it the game, which is basically a yin and yang, where my whole learning style breaks down into two techniques, equals and versus. These two techniques are opposite because equals is all about one thing and versus is all about two things. Another opposite way to put it is that equals is about equalizing things, making things the same, or grouping things together that are the same, whereas versus is about finding the difference between things and splitting them apart. So equals is about forming groups by grouping things together into the same bucket. Versus is about forming groups by splitting things apart into separate buckets. So they're both important for that reason. When I say equals has to do with one thing, what I mean is usually equals will be if I say a word like interstitial infiltrates on chest x-ray equals what? So interstitial equals atypical. When they say that word interstitial on the chest x-ray, it automatically tells you that the microbe is an atypical microbe, either a virus, fungus, or an atypical bacteria. Then if I want to do versus, I would say, well, it's interstitial versus lobar, right? Or diffuse versus lobar. So I could also say interstitial equals diffuse because those are loosely synonyms when it comes to the actual, like what the clue they're giving you is. So diffuse versus lobar, that's like systemic versus focal, or diffuse versus focal. And that's going to be atypical versus typical bacteria. So there are two sides to it, and then there's also equals on either side, because this word is basically another word for this thing, or this word represents this thing, or is a clue for this. So all the other, even though that's like the simple rundown, it's like there's more things that I use that I wasn't always putting words to, but all of them fit into either one of these categories or the other. So for equals, what are some things that fall into it? I split them into two groups, form and function. I can say what the form of that term, of that word is, or I can say what the function of that word is. So for form, what I mean by that is language, the actual like shape of the word rather than its meaning. So one technique that falls under that is hyphen. This is a really important initial technique for me, which is basically building the habit of every word, instead of writing it as one word, I hyphenate and use that hyphen to break it down into its parts. So interstitial. Inter means between. Stitial means tissue, which you can kind of see from the spelling, right? So it means between tissue. So interstitial means connective tissue. It's the tissue that is in between other types of tissue and connects them. So just that sort of thing. I made that a habit, so it was really helpful for understanding the language and not having to memorize all the terms and things because I know what the parts mean. So that was an extremely important technique for me, hyphen. Then under form, I also started saying puns, which basically just mean I put a music note because anything musical, whether it's puns, rhymes, alliteration, all of those poetic things that you can do with language, make things easier to remember. So anytime I can, derive some sort of pun or some sort of language connection between things, it makes it easier. Even if it's not that good. Like for instance, I was not remembering that with asplenia, the risk that comes with that is sepsis. Obviously, it makes sense. You don't have a spleen. You can't fight infections well, blah, blah, blah. But the issue was that general idea was not enough for me to get it right because I needed to contrast it with Bruton's because I was choosing that instead and getting it wrong. So Bruton's versus asplenia is when you don't have antibodies versus when you don't have a spleen. Both of those things are used to fight bacteria. So that doesn't help you differentiate them. What helps you differentiate them is that in Bruton's, they get recurrent infections, whereas in asplenia, they get sepsis, which is a systemic infection. So recurrent infections versus systemic infections. This has to do with time. Recurrent has to do with time, whereas systemic has to do with location or space. So it's two opposite types of problems that are being caused here. And I didn't realize that at first. So I have the verses, but in order to help me remember the equals, because I know Bruton's versus asplenia is recurrent infections versus systemic infection. But in order to help me remember just the equals of asplenia equals sepsis, I play with the language and I started calling it splenic sepsis. So in the beginning of the word, I have this SPE, and then in the beginning of this word, I have this SEP. Even though it's not like a perfect lineup, it's just kind of a bit of alliteration, and it just helps to make it easier to remember when I make a little cheesy little phrase for myself. So now I call it splenic sepsis. I don't call it sepsis. I gave it a specific name of my own where I'm basically acting like this is its own kind of sepsis called splenic sepsis. And that helps me to remember that association. So I have the SPE, the SP and E in both of these words. So that's like a language trick, pun, rhyme, whatever, that I'm using to help me. And that kind of ties into something else that I call a mantra. Mantra, which ties into this technique nickname. But I'll talk about the mantra thing. Mantra basically means anytime I make a little like phrase that I say as soon as I see a certain word or a certain thing. So when I see that somebody doesn't have a spleen, I'm immediately going to say the words splenic sepsis. That's my little mantra. It's one small consolidated phrase that has a rhyme or a little rolls off the tongue or whatever that I can say that encapsulates a larger amount of information into one small phrase to easily remind myself. So splenic sepsis reminds me that this is sepsis specifically, not recurrent infection. And it reminds me that it's associated with the spleen specifically, not other things like antibodies. So I'll do that a lot. Mantra, where it's basically the point is to take a wider concept and condense it into a small, simplified, very condensed form, not just a simpler explanation, but to condense it into like one phrase or one word or just a couple words, right? Condense it into one mantra so that now it's become so condensed that I can pull it out and use it at any time. And I like to compare it to a Pokeball, like in Pokemon. It's like the whole point is they throw the ball at the creatures, right? And then the big giant monster or whatever gets like sucked inside this tiny ball. So you're able to carry this big giant dragon or whatever around with you in your pocket because you captured it into this small condensed little Pokeball, right? Which is supposed to be like a pocket ball. So you can carry something very big in your pocket around with you as if it's very small and easy to carry because you condense it into a smaller form. That's what the Pokeball is. So that is pretty much what I'm trying to do whenever I come up with a mantra. And then because it's so small, this little phrase that you're saying, splenic sepsis, it's easy for you to pull it out and say it like all the time, anytime you encounter this topic. And so you can remind yourself of a big concept without having to use a big amount of words and a big amount of time. And I think that's the purpose of names in general. We name things so that we can refer to them without having to describe every single little detail about it. Instead of saying, oh, do you see that object that you can wrap around your upper body and it has holes inside it and it's red? You can just say, do you see that shirt over there? So it's more efficient. That's the point of names. So then when I have a concept that I need to know, I will give it a name if the material hasn't already given it a name. I'll make up a name. If they have a long name, I'll make up a shorter name. That is mantra. And that allows me to be more agile in how I can call forth ideas and use them in the moment when I need them. It allows me to take a big idea and make it small so it's actually usable. Okay, so that falls under equals. The other bucket that falls under equals is function. Why is this equals? Because if I give you the word interstitial, you should say interstitial equals, you should hyphenate it, and then you should say equals between tissue. You change the real name into the, you translate it into the meaning of that real name, right? The actual meaning, you translated it. This equals this. They both mean the same thing, you translated it. That's hyphen. Then a pun is like, you know, when you see that sepsis or whatever, it equals this little mantra or this little phrase you made up, splenic sepsis. The other thing that falls under equals is these function things. Instead of dealing with manipulating the language to make things easier to remember, so the terminology, instead it has to do with the actual meaning of the words. So for instance, nickname is a really important one. Basically, the point is that I will give things a nickname. And that also falls under equals because the whole point is when I see this fancy term, I go equals in my head and I translate it into my nickname for it. And that is a very, very helpful and powerful habit if you actually make it a habit and do it constantly. So the idea of nickname is it's basically about analogy. I'm constantly making an analogy for things. So if I'm trying to think of a random example, like the right heart versus the left heart, right? I have multiple nicknames. First of all, I consider them as two hearts, not two parts of one heart. I consider them as two separate organs loosely in my head. Obviously that's not technically true, but that's to make a point to myself. So the right heart pumps to the lungs, the left heart pumps to the body. Two opposite pumps, two opposite destinations. They're both doing two opposite things, and they have different qualities. The left heart is pumping to the whole body, so it has to be bigger and stronger. So it's a bigger organ than the right heart. It's more muscular. I say all that to say, what's my nickname going to be? Right heart equals the lungs heart. That's one nickname I have for it because it supplies the lungs. It's part of the pulmonary circulation, not the systemic circulation. See? So two different hearts, two totally different circulations. On the other hand, the left hand, or the left ventricle, or the left heart, it pumps to the body. It's part of the systemic circulation. So I call the right heart the lungs heart, left heart the body's heart, or I'll call the right heart the weak heart. That's another nickname. And the left heart is the bully, the strong heart, or the bully. Why do I say bully? Because it's higher pressure. Whenever you have a VSD, a shunt between the two hearts, the left heart is going to bully the right heart and, force all this blood into it because it's going from a high to a low pressure. And the thing is that I don't need to call it bullying and do all this analogy stuff because I can just explain it's going from a higher pressure to a lower pressure and therefore it's going to cause more, blood flow into the pulmonary arteries coming from the right heart when you're overfilling the right heart. And then it's going to cause increased vascular resistance, blah, 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 blah. The problem is that if I'm doing a problem and the only way I'm able to remind myself of how this stuff works is by going through every single detail in like horrible long words and explanation, it's going to make me very slow at using the ideas. It's going to make me very prone to making mistakes and stuff. And it's just not like practical. It's not an agile way of thinking and recalling these ideas and applying them. So even though I already know how it works without analogy, I don't need the analogy to understand it. I still am intentional to make the analogy, to condense the long explanation into a very smaller, short mantra that's based on these smaller and shorter nicknames. So instead of saying all of that stuff, what I tell myself now when I see that situation in a question is I remind myself the left ventricle bullies the right ventricle, and the vessels take the brunt of that. The vessels being the pulmonary arteries that that are associated with the right ventricle. So that reminds me that I'm supposed to choose increased pulmonary vascular resistance and not choose the other things. Basically, the whole point is that I took that concept and shrink it into these, or condense it, package it into these small words. There's better examples for nickname. I'm just not thinking them off the top of my head. I talked about the heart. What if I talk about lungs? What would I say? This is really not, I guess this is a nickname. Not really. It doesn't always have to be something cute or made up or whatever. It just means using a different word or using a simple word. So sure, this will work. When we have poem, the whole point is that it splits, this is verses now, it splits into restrictive diseases versus obstructive diseases. Every single poem disease falls into one of these categories. And the general rule is that obstructive equals airway. So my nickname for the obstructive diseases is just that one word, airway. Versus restrictive equals lung. There's only one exception. There's only one disease in the lung that is obstructive rather than restrictive, and that's emphysema. But that's super easy to remember because emphysema is a type of COPD, and the O in COPD means obstructive, so it's fine. So you don't really have to remember it because it's there. Every single other thing, you just know it by default. If it's a lung problem, it's restrictive. If it's an airway problem, it's obstructive. Airway meaning the bronchi and the bronchioles and the trachea and all that stuff. So I have different nicknames for these buckets. And that's what this is all about. So it's about condensing things down, and it's also about analogy, which is a really, really powerful, really helpful, and really important tool when trying to understand the relationships between things. And we know learning in general is all about building relationships and connections between things. And I think those relationships and those connections, all of them boil down to pretty much just only two types of things. What the things have in common and what the things have that's different, right? So comparing and contrasting. And that's other ways of saying equals and versus. And that's why I love using just these two things to guide how I think about anything that I'm learning. So under function, I also have buzz. It's kind of similar to nickname. Kind of don't remember why I wrote it down, but it's like the buzzwords and the buzz phrases. They say that they're moving away from buzzwords and NBME, but I think they're kind of not, because they literally still use buzzwords. It's just like they don't call it a buzzword. Like, even if they don't say blueberry muffin or something like that, it's obviously a quote unquote buzzword. If they say interstitial, you automatically know what that means. Like, that automatically tells you something. Like, automatically tells you, if all your answer choices are bacteria, choose atypical, not typical. So that's pretty much a buzzword, because it's a word that as soon as you see it, you automatically know something very significant about the answer, even if the question has more to it than just that. So I think that I always look for like buzzwords and buzz phrases, and I always try to learn what they mean. And of course, somebody might not call it a buzzword, but I do, because that's how I view those things. So all those descriptors for X-ray, they have this X, Y, Z on X-ray. It's a buzz phrase. And when I'm doing my chat GPT, I have a chat where I tell it, you will tell me the significance of every buzzword and buzz phrase in this question, and why it points to whatever answer. So yeah, I guess that's what that's there for. So now with verses, what's this? I put a yin yang here. This is like my whole thing. This is the whole verses thing and the whole like foundation of my learning approach that helped me to stop having so many problems with learning stuff in med school and everything. So it's the yin and yang thing, right? This is basically verses. It's just the mindset that every single topic and thing splits into two sides, two groups, two buckets, whatever. And they're going to be opposite. They're going to be complementary. They're going to reflect and mirror one another. And if you're looking for them, they're always there. That's the cool thing. So you don't really have to make it up. The themes that we learned really are opposite in one way or another, and that's why we're learning them. They're not going to ask you to differentiate two themes on a multiple choice test if those two themes were actually exactly the same. Those things are going to be similar, and there's going to be one key difference that makes them kind of totally opposite to each other while also being both part of the same category. In the same way with your yin and yang, you have the white and the black, which are totally opposite, but they're both a part of the same whole. So I put this here, but I actually will start with this theme, space-time. So with the verses, it was about like something in the material that I'm putting into the context of verses. So for instance, for poem, when they say restrictive disease, if somebody said restrictive versus, I should be able to finish that sentence and say obstructive, restrictive versus obstructive. But I started to benefit from this theme that's like a verses that's not in the material. It's something that's overarching outside the material, but it helps me to organize a lot of concepts that I learned within the material. And that was a space-time thing. So the whole point is that I noticed that a lot of timing is really important in a lot of stuff we learn in med school. So acute versus chronic, right? And I started to pay more attention to that. On MBME questions, for instance, or like STEP stuff, if they say hours or days, I don't even read the words hours or days anymore. I just automatically say acute. If they say months or years, I automatically say the word chronic. Even though there's multiple descriptors, hours, days, weeks, months, years, right? I put them all only into two categories, acute versus chronic, because that's the meaningful thing. Then for weeks, that's the one that's kind of in the middle where it could go either way. So I call it subacute, and I don't pay as much attention to it because it's not as strong a descriptor as those other things generally. So acute versus chronic. What else is there? There's like the stuff with the different types of leukemia and the age for that, right? So another part of timing is age. So below 45, that's a young adult. Below 60, that's middle age, right? Like the 50s are middle age. Then above 60, that's old or elderly. That sort of thing. Pay attention to age is really important. So this framework helps me. This is like a mantra in itself. Space-time, to help me remember that. And so, for instance, when I was talking about the Bruton's versus asplenia, it was recurrent infections versus systemic infections. Recurrent means they're getting infections over and over and over. It has nothing to do with the location in their body. It's all about the timing. They're getting it over and over, time and time again. Versus the systemic infection, it's not about time. It's all about the location. It's the fact that the infection is spreading all throughout their body. That's the issue. Not that the infection is spreading over time, right? Happening again and again all across time. So the fact that one of those is time and one of those is space, because that fits into this overarching framework that I already use for lots and lots of other things, it makes it now easier to remember that. So this thing, space-time, because so many things fall into it in that way, now that's something I use. So I think it's easier if the more you see examples. I don't know if that is very clear, but whatever. So space-time, it splits into space and time, obviously. These are the two components of like the universe or whatever with physics and all that stuff. It's like everything is, space and time. I'm not a physicist, but, it's like a vague notion that we all kind of know about. So time, for medicine at least, for me, basically splits into acute versus chronic. Space, where and how I put this thing, is kind of more general or more vague than that. I kind of use time because it's important and unique. And then whatever the other thing is, I just call it space. But it often ends up being like location-based. So it kind of works out. But I think my main thing for space is this thing, my little drawing. So when it comes to the body, if you were to draw like your body, there's a head, there's a thorax, there's an abdomen, there's like your pelvis, and then there's your legs, and then there's your arms. And it's kind of like a lot of parts. But the thing is, your limbs, so arms and legs, don't have any visceral organs in them. So they're not that important as far as like survival and like medical things that can happen. Obviously, your limbs matter, obviously, but you know, I'm trying to make a point. So they're not that important. They only have muscle and bone in them, right? Muscle, bone, and skin. They don't have liver, heart. They don't have any organ systems in them. So they're not important. So boom, 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 boom. I remove them from my overall framework, like simple, quick framework of the body and things that can get affected by diseases. And then the pelvis is continuous with the abdomen. You learn that in anatomy. So it's kind of almost not its own thing. So I remove that. So the main components of the body really splits into just 3 parts: head, thorax, abdomen. And of course, our goal is always to reduce everything to 2 parts, yin and yang, not 3. So what do I say then? I say your whole body is 2 parts. It's your head and your torso, right? So if we remove the limbs from the side, then we can see that the whole body is basically just a torso, which is kind of funny to think about. It's like your body's basically just a torso, because like all your like important organs that really matter, your brain, heart, lungs, liver, all that stuff, kidneys, it's just like in your torso. So it's like, okay, my body's just this little bean in the middle, and then the long limbs that take up so much space are not really these like super important parts of my body. So I just draw the torso. Head versus torso. And then torso splits into thorax versus abdomen. And now I've kind of condensed the body down into these main parts and regions. And it's really helpful when we have to learn diseases that have systemic effects and affect all these different random organs, right? Oh, you know, this thing is going to affect, you know, their heart, but also their, liver, also their whatever, right? Like we can think about ADPKD, right? Autosomal dominant polycystic kidney disease. It will affect their kidneys. They get cysts on their kidneys. They have cysts on their liver. They have quote unquote cysts on their heart, which is just the aneurysms or whatever it is. And then they have like quote unquote cysts on the brain, which is the aneurysms, buried aneurysms on the brain. I don't remember what the heart thing is. It's something. But at least I remember that there's something on the heart. Why? Because I know that it affects all 3 of my main regions of the body. PKD affects the abdomen, the thorax, and the brain. So at least knowing that it checks off each one of these 3 allows me to, even though I didn't remember what all the effects were, I at least know, okay, I know it affects the kidney because that's the whole point. It's a kidney disease. And I know it affects the liver because the liver is a filter similar to the kidney. But I also know it has to affect something here and something here, the heart and the brain. So anyways, when it comes to space, when it comes to time, it's acute versus chronic. But when it comes to space, I think the main thing for me is this drawing. It helps me conceptualize the space, the locations in the human body, and simplify it down for myself, give myself a framework to work with. This other thing is more of a newer thing, but it's like basically like if it's not a space-time thing and I'm trying to kind of force a contrast between things or force myself to notice one or even like kind of make one up for the sake of like a mnemonic for myself, then I'll go back to the yin yang and put things actually into like a hard versus soft category. That's kind of like a whole nother thing. I won't go into that, but that's why that is there. So these are like my main techniques that I use, where if some fact doesn't make sense or I can't think of a way to remember it, instead of sitting and racking my brain trying to like think of a way to remember it, I know what I should do. I should take the word, like the key word of what I'm dealing with, say equals, and then try to translate it into some nickname or some analogy that encapsulates what it is, or try to like say something that it connects with, and then I can say versus and say, so what would be the opposite of this and that sort of thing. And I already know the structure that all of the relationships I'm going to build fall within. They all fall within this equals and versus. So it allows me to like find those connections faster because I know the connection has to be either this or this. And it's not really either, it's both. And that just is helpful for me. So instead of like skipping the thing and be like, oh, I can't remember it, I'll just like try to like see it again later and hopefully it sticks or whatever. Instead, I can actually like come up with a connection or a way to remember it. And then it exposes gaps. My thing that I say is that you should be able to say any term or any word in medicine, and you should be, if I say that word and then follow it up with equals or verses, you should be able to finish that sentence. If you can't, that exposes a gap that you know what to fill. You can just look it up really quick and fill that gap. So, yeah. Yep. For instance, the thing from before, interstitial versus, you should be able to say lobar for those two types of pneumonia. If I say tumor, right, versus, we can say cyst because we're thinking of something that's solid and filled in versus something that's kind of emptied out and filled out with fluid. But they're both round masses, right? So when you do versus, you're always comparing to something that is opposite but also the same, right? They're in the same category, round masses, but they're opposites within that category. One is full of solid, one is full of fluid. Autosomal dominant PKD versus it's autosomal recessive PKD. That pairing equals what? It equals cyst versus scarring, right? A big kidney versus a small shrunken kidney, right? And so on and so forth. So now these are not two random things I have to remember or whatever. These are things that I have positioned as directly opposed to each other in my mind. So when I remember one of them, it makes me automatically remember the other one without even having to actually recall it, because the definition of the one is implied by the definition of the other one. So if I remember one, I get both of them, right? If somebody tells you, hey, the top side of this coin is heads, then you already know what the bottom side of the coin is tails. They don't have to tell you. You don't have to memorize that. You know it because you already have this opposite relationship established beforehand. So that's what's helpful about the versus thing.